Welcome. Hello, everyone. Welcome to 1MD Nutrition's live stream. First, we're going to jump into a little bit of housekeeping. We're going to pop our disclaimer on the screen. As you know, 1MD Nutrition live broadcast presentation only reflects the views of 1MD Nutrition's board-certified physicians licensed in the state of California. The statements made in this 1MD YouTube live broadcast presentation have not been evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease and are intended for educational purposes only. All right. Hi, everyone. It's been a while since we were with you. I'm so glad to be back in studio. And if you don't know who I am, my name is Jennifer Fontaine. I'm the creative brand manager for 1MD Nutrition. I have been with this company for about 6 years now. They call me Mama 1MD. And I couldn't be more proud and happy to be with you guys today for this next 30 minutes to talk about American Heart Month. About 12% of adult Americans and 7% of American children have high cholesterol. And having elevated levels of the wrong types of cholesterol increases their risk for heart disease. It's the leading cause of death in the United States. And despite the fact that most people have heard of cholesterol, there's still many cholesterol myths floating around. So today we're going to sit down with interventional cardiologist, Dr. Heather Shenkman, to dispel these myths, educate you on how to proper monitor and manage your cholesterol properly, and to answer your cardiovascular related questions. And then later on in the broadcast, we're going to give away a 3-month supply of CholestMD, which is our #1 best-selling cholesterol management supplement. And yeah, without further ado, let's bring her on. Where is she? Dr. Shenkman.
Hi.
Hello. How are you?
And how are you?
I'm doing fantastic. It's great to see you. I always love sitting down with you. So let's tell the audience a little bit about you, if they're not familiar with you and your work, your clinic in LA, and a little bit about how you work with 1MD Nutrition.
Sure. So I am an interventional cardiologist, but I also am not only focused on intervening with catheters and stents, but I'm very much an advocate for lifestyle medicine, for preventing these diseases as well. I'm a big advocate for not just traditional medical therapy, but for lifestyle, encouraging my patients to put good food into their body and to exercise and take care of themselves.
Yeah, and I think that's what led you to us as well in our partnership, right? I think a lot of times when patients go to their doctors, they're kind of not even aware of what nutrition intervention is available for their patients. And I think that the big reason, our reason to be really for 1MD is to work with doctors that are passionate about nutrition and bringing that to a wider market. And so we couldn't be more excited to work with you, especially with your background. If you want to give them a little bit more about your health lifestyle background, it's very interesting to me, and it might also interest our listeners.
Sure. So I am somebody who's very interested in sports, and I started a little triathlon habit as an adult. I've done about 100 different events of various distances, from all the way ranging from sprint triathlons to Ironman distance triathlons. I've done century cycling events. I've even dabbled a little bit in swim meets. But for me, I feel like exercise is so important in terms of keeping me healthy and keeping my brain working well. And also I like to set a good example for my patients so that they know that when their cardiologist is telling them that they should be exercising and eating healthfully, that their cardiologist is also doing the same.
Yes, practice what you preach. It's so important. I agree. And what are some of the things that you tell your patients, about their heart health? What do you think is the biggest reason why they're coming in to see you? Are they concerned already?
I think there are a lot of people that are concerned about their heart health, and for good reason. We know that heart disease is the #1 killer, not only here in the United States, but worldwide. It is the #1 cause of death in both men and women, and about 80% of all cardiovascular disease is preventable or modifiable with lifestyle alone. And in addition to that, we have medications that can help reduce risk as well. So there's so much that people can do themselves to reduce their risk of developing heart disease. And people realize this, and they want to be evaluated.
And I think, one of the biggest indicators that we have for, heart health in general and or cardiovascular disease is our cholesterol. I think cholesterol generally gets a bad rap, but can you explain to our viewers its function? Because we do naturally create cholesterol, and there is a function of cholesterol in our body. So can you just explain to our viewers its function and its importance?
Sure. So cholesterol is something that our bodies naturally make. Cholesterol is a waxy substance that we need in order to build cells, to make hormones, and to make vitamins for our daily functioning. Our body actually makes more than enough cholesterol, so we don't need to consume it from foods. And the other concern about cholesterol, though, is while it does good things for the body and that we need it for daily function, having too much is definitely problematic. High cholesterol contributes to increased risk of cardiovascular disease, including heart attack and stroke, because cholesterol can deposit within the arteries and lead to a condition called atherosclerosis, which is plaque within the arteries.
Oh, yeah, right. And there are differences between the types of cholesterol and HDL, LDL. We all hear these acronyms, and maybe you can provide a little bit of clarity as to like what HDL, LDL, triglycerides, what does it all mean? Break it down for us.
Right. So HDL and LDL are actually not cholesterol per se. They are lipoproteins. They're particles that transport cholesterol throughout our system. So LDL stands for low density lipoprotein, and these deliver cholesterol to the cells and help to deposit cholesterol into the cells, leading to plaque buildup within our arteries. Now, HDL, which is high density lipoprotein, actually does the opposite. It transports cholesterol from the cells to the liver and helps to excrete cholesterol from the body. Triglycerides, which we also measure when we check somebody's so-called cholesterol profile, are the most common fat found within the body, and it is how calories that are unused are stored within our bloodstream and can help to provide us with energy.
And what would you say would be like a normal cholesterol level range if you were, let's say, in your middle years and looking to hit a target of a healthy cholesterol level?
So somebody who is a normal, healthy adult who does not already have heart disease, an LDL cholesterol less than 100 is what is considered to be ideal. Now, HDL, or high density lipoprotein, actually is typically protective of the heart, and we like to see higher numbers. So for men, we like to see higher numbers greater than 40. For women, we like to see numbers greater than 50. Ideal would be more than 60. Triglycerides, we like to see that level to be under 150.
That's I've heard that term before. HDL is like they call it the good cholesterol, so that's the one that really helps to excrete it out. That's I like the way that you explain that because I hear good and bad, but we don't always know like how that translates into its actual function and why it's good for us. So thank you, thanks for explaining
Sure.
that.
So let me just add one thing in though. So there
Sure.
can be too much of a good thing. So
Mhm.
HDL cholesterol levels that are higher than 100 actually paradoxically are associated with increased risk of heart disease. So you don't necessarily want your HDL cholesterols to be very, very high.
Is there such a thing as like hereditarily high cholesterol where it would not be as alarming to see higher cholesterol levels or not so much?
Well, there definitely are genes and hereditary conditions where people's cholesterol levels are high, but unfortunately, regardless of the cause, exposure of the body to higher cholesterol levels does lead to increased risk of heart disease. So regardless
Okay.
of the cause, you do want to get those numbers down.
Understood. I'm literally asking that personally because my husband, he has like it appears to be like hereditarily like elevated cholesterol, nothing like exceedingly dangerous. But we always wondered, well, is this something it runs in the family, so you don't have to worry about it as much. But yes, of course, like obviously you have to always maintain a healthy diet and all that stuff, which we'll get to. We'll get to a little bit later. But I'd love to talk. So as we're talking about cholesterol levels and what that means and everything and how they function in the body, let's walk our viewers through what they can expect to experience. Like if they want to get their cholesterol levels tested, how do they go about doing that? Is it a scary thing? We want to make sure our viewers aren't scared to go to their doctors and get these tests because they're important, right?
They are important. We typically recommend that healthy adults over the age of 20 have their cholesterol levels checked about every 4 to 6 years. As people get older, or if they have other risk factors, you might want to be checking your cholesterol levels a little bit more frequently to keep tabs on them. Now, cholesterol levels are typically checked as a blood test, and it's typically done in a fasting state, so without anything to eat for about 9 to 12 hours before the blood test. But for most people, fasting is really not necessary because yes, the LDL cholesterol is definitely affected by what we have recently eaten, but it doesn't make a large difference. So if you're an otherwise healthy person, you probably can get away with getting your cholesterol checked without being fasting for a long period of time. But if you're somebody who is on a cholesterol lowering medicine, or if you're somebody who has severely elevated triglycerides, it is more important to get a fasting cholesterol profile just so that we get more accurate measurement of the LDL cholesterol.
Yeah, that makes sense. You wouldn't want to eat like a big steak, a big ribeye steak before you go in, right?
This is true,
Things
correct.
things to avoid. Speaking of that, like, so what are the causes of high cholesterol? With the most frequent high causes.
So Jen, we already touched on some of this in that genetics definitely play a role. So there are certain genes that are associated with very high cholesterol levels. And if you have any first degree relatives, a mother, father, brothers or sisters who have had high cholesterol, you are somebody who may have genetics that predispose you to higher cholesterol levels as well. The diet definitely impacts cholesterol. So eating foods that are animal products, particularly red meat and processed meats, are going to raise the cholesterol levels. Full fat dairy, also products that are high in saturated fat or trans fats. So, baked goods, tropical oils like coconut oil and palm oil also are going to raise the cholesterol levels, even though they themselves are not actual cholesterol. Obesity.
This is interesting. I'm sorry to interrupt you because coconut oil, right? Like, 5 years ago, everyone screamed about the health benefits of coconut oil. But I feel like as we're sort of peeling the onion back a little bit on coconut oil and oils in general, even olive oil per se, it really is, like you said earlier, it's all about moderation and understanding that, yeah, they're healthy, but they're still oil. Right.
Right.
Yeah. Yeah. Sorry to interrupt you, but you were saying about obesity.
Yes. So the more weight that you carry, the greater the risk you have of having high cholesterol levels. Alcohol, drinking excessive amounts of alcohol also will raise the cholesterol levels, particularly the triglycerides. Age is a risk factor for high cholesterol because as we get older, the liver is less effective at clearing cholesterol from our bodies. Certain medical conditions are associated with increased cholesterol levels. So kidney disease, diabetes, HIV, thyroid conditions, particularly hypo or underactive thyroid, and lupus will be associated with higher cholesterol. And then there's certain medications which can raise the cholesterol levels. Some medications for acne, some cancer treating medications, and some of the medicines that treat blood pressure and HIV can also raise cholesterol levels.
I think it's important what you said earlier. We're talking a little bit about hereditary predisposition to potentially having like higher cholesterol, but it's also like hereditary environmental factors, right? Like
Yes.
having grown up in the South, I can tell you that, this diet and lifestyle thing is definitely hereditary, and it's something that I personally have fought against my whole life. Most of my family is obese. Cardiovascular disease runs in my family as well, and mainly due to those lifestyle and nutrition factors. And it's really just about breaking that cycle. It's always the hard thing to do, though, right?
Absolutely, absolutely. Even with the worst of genetics, having a good, healthy lifestyle is so important at keeping yourself healthy and reducing your risk.
Yeah. So on average, how long would it take? Like, let's say, let's take my husband, for example. He just got his levels checked. They're a little on the high side, nothing to be concerned about, but he's now on his program, and he's got a goal to achieve. How long could he expect to see results? How long would it take to reduce that cholesterol level?
Now, lifestyle change, it takes a little while to see an effect on your cholesterol profile. So with eating better and exercising more and losing weight, it may take up to 3 to 6 months to see real change in cholesterol levels.
Mhm.
However, if somebody were to be put on medications such as a statin medicine, we would see that the cholesterol levels would drop a whole lot quicker, even in the matter of a course of a few weeks.
Now, do you recommend statins, though? I mean, I think we actually have a question in the chat from a viewer right now talking about statins. So I'm glad we're bringing this up. I know, like, obviously, it's recommended if you are at high risk, you have to take a statin. But tell us about the benefits and the pros of the pros and cons of statins, and when you should and shouldn't.
Sure. So that's a pretty complicated question.
Hmm.
And it's something that I dedicate a lot of my day in, day out work to. Statin medications are very potent at lowering cholesterol, and in the right person can help to reduce the risk of heart attack and stroke and progression of plaque within the arteries. But we always give very strong consideration to who gets those. So if you're somebody who already has cardiovascular disease, you should be on a statin medicine. If you're somebody whose cholesterol levels are above a certain threshold, the guidelines that we have suggest that a threshold is an LDL above 190. You should probably be on a statin medication. Also, people who have diabetes over the age of 40. Otherwise, what we typically do is something called shared decision making. So I'll sit down with my patients and we'll go through their history and talk about what their risk of heart disease is. And if the risk is above a certain threshold, then perhaps it would be of benefit to be on a statin medication. But I think that's very much an individualized decision for all patients, and a good conversation to have with their doctor. Now, as with any medication, a statin is not necessarily a benign thing. The most common side effects of statins are muscle aches, and we notice that about 5 to 10% of all people develop muscle aches on a statin medicine. That said, the majority of those patients, we can switch them to a different statin or decrease the dose. We also have other medical options for lowering cholesterol for those people who do need it, from pills to injectable medications. So if there needs to be some sort of intervention beyond just lifestyle to lower cholesterol, we have a lot of options available.
That's great information. Thank you so much. I wanted to go back quickly to, the reduction of cholesterol. And we were talking a little bit about like how quickly someone who's only approaching, changes to their lifestyle and nutrition. So they're not necessarily at that level yet where they're talking to their doctor about taking a prescriptive. What are things that they can do to reduce their cholesterol? I know, there are many things, but let's touch on a few of the really great things that move the needle for people who are really passionate about, avoiding that pill and changing their lifestyle.
Sure. So, regardless, we always advocate lifestyle as the first line of therapy for cholesterol, whether person is on medicine or is not on medicine. Eating a healthier diet, so eating more fruits, more vegetables, leaning in a more plant-based direction, less fried foods, less processed foods, less foods that have saturated fats, and then fewer animal foods, namely fewer animal foods that are red meats and processed meats. Eating in a healthier manner will definitely help to lower cholesterol levels. So does exercise. So having a regular exercise regimen that is on a consistent basis can also help to not only lower LDL cholesterol, but also to help to slightly raise that HDL, or that quote unquote good cholesterol.
Mm-hmm. And you also mentioned smoking earlier. I think that's
Yes.
also a very big contributing factor. Yeah.
Yes.
I wanted to know, uh, because a lot of times we talk about cholesterol as being the sort of like a diagnostic thing that you can't really understand what's going on inside of your vascular system without testing first. But are there actually signs that we can see within our body that might give us that like, oh, I may need to go to my doctor and get my cholesterol checked?
So the majority of cases of people who have high cholesterol are people who have no symptoms at all. But in some people who have very high cholesterol, there are things that we visually can see. So xanthelasmas are yellow patches, which can be seen around the eyelids, or xanthomas, which are yellow deposits on the tendons of the body. There's also something called an arcocinilis. So in people who have high cholesterol over a period of time, they can get a grayish circle around the iris, or the pigmented part of the eye. And this can be a visual sign of high cholesterol. Unfortunately, for some people, the first sign of high cholesterol is a cardiovascular event like a heart attack or a stroke, which can be devastating.
Yeah. And if people are getting their cholesterol checked within that recommended 4 to 6 year time period, then you're generally okay to catch something before it gets to that level.
Well, that is what is thought to be the case.
Hopefully.
Yes.
Hopefully, yeah. I know we talked a lot about diet and lifestyle, but I think another thing that many people probably don't understand as a contributing factor here is stress. We're all under a lot of stress. Can stress actually cause your cholesterol to become elevated as well?
That's a really good point, Jen. Stress actually definitely can drive up cholesterol levels, and there's a few reasons for this. Number one, long-term stress does increase our cortisol levels, and increased cortisol is associated with increased production of LDL cholesterol receptors. But also, stress in and of itself causes us to make less than ideal choices when it comes to our health. When we're stressed out, we have less time to be putting good food into our body, or less desire, and we're going to more grab and go our food and not make the time to exercise and do the things that we should be doing. So stress, for several reasons, does raise cholesterol levels.
That to me, that is like the key point, the takeaway here, really, because in my mind, when I heard that stress was a contributor to high cholesterol, it was like that linchpin, it like exactly what you just said. It is that slippery slope where we continually make decisions that aren't necessarily good for our health. We stay in bed all day, we drink too much, we eat bad comfort foods, which are bad for you. And the more and more I keep reading, this literature about cortisol, and a lot of the population right now is really like at this high stress level with cortisol. It's always pumping through our bodies. It's definitely something I think that we all need to take heed of and get under control. What are some other methods that you would recommend for people to de-stress? I know probably triathlons, running.
Well, I think exercise is a great form of managing stress. I mean, for me, it's something that I need in my life to keep my stress levels under good control. Meditation, taking a few moments every day to just sit and be quiet and focus on your own breath can be helpful. Things like yoga, finding things that relax you, whether it be, reading, for example, or listening to music. These are all good things that can help us to decrease our stress levels.
I love that. One of my New Year's resolutions was reading more. And I tell you, I got one of those habit trackers and reading is on there. And I instead of reaching for my phone in the morning when I wake up, I have my Kindle next to my bed and I grab my Kindle and I read for, like 15 minutes. And it really helps sort of like set the mood for the day. I don't know. It's something that's helped me a little bit. Um, I want to thank you so much, Dr. Shenkman. It's always a pleasure and so enlightening to have you here in the studio. Um, any other last words of advice for our viewers before we sign off for the day?
Um, I think that when it comes to cholesterol and overall heart health, you want to start with the basics. There's no one magic bullet or magic pill that's going to keep your heart healthy forever. But taking good care of yourself, realizing that 80% of all heart disease is from lifestyle. So get in the habit of exercising regularly, putting good food in your body, staying away from cigarette smoking, managing the stress in your life.
Wonderful. I love it. Thank you so much. We'll see you very soon. Take care of yourself and thank you so much.
Thanks, Jen. Great talking to you.
Yeah, you too. We have the winner. Just selected our winner of a 3-month supply of CholestMD, which is our cholesterol management supplement. And the winner is Debbie Campbell. Congratulations, Debbie. I want to thank everyone, all of you guys, for your great questions and for tuning in to our live stream. We'll be back in a couple of months for Men's Health Month, and we're going to be talking about prostate health with Dr. Bryson. And in the meantime, we wish you all the health and happiness, and we will talk to you all soon.